All right. Well, hello, everybody. Welcome. I'm so glad you can join us for today. And, we have a somewhat smaller group today, which means that we're going to have plenty of time for questions. And I really encourage you all, to ask questions if you'd like. I'm going to go through a presentation. It'll probably take about 40 minutes, and we should have uh, probably right around 20 minutes just to dig into some of the details. I'm sure many of you are dealing with some of these questions or some of these issues in your practice, or maybe you're just thinking about them if you're a student. But I'm so glad that you joined us today. I'm Charlotte Tschider. I'm a professor at Loyola University, Chicago, and the focus of most of my work is on healthcare as sort of a sector, but also cybersecurity, artificial intelligence, and privacy law. So, the focus of today's discussion is about cybersecurity law in particular, but I am going to try to blend in some of the AI related conversations because I think they're very important to sort of the future of data protection in the healthcare space. Okay, so I'm going to start by sharing my screen. And of course, the title of this presentation is, can healthcare cybersecurity law outpace attackers? The short answer to that question is obviously not. One of the biggest challenges we have with the law is really being prospective and understanding what the future will look like. And there are just a lot of unknowns at this time. But I might also say that often technology is going to be in front of the law. The law is often playing catch up. But when we think about healthcare cybersecurity, the law is really, really far behind, which we'll talk about through this presentation, as well as what I think is maybe a hopeful next kind of next step, next generation, and encouragement on what organizations can really do in this space, even when the law has not added a lot of significant detail. All right, well, to start, I just want to illustrate that in healthcare, we have serious cybersecurity issues. We have serious potential threats, and it's not just in one arena. I think that often when we talk about data breaches, we talk about cybersecurity attacks, we're thinking about medical records. But we're also thinking about a lot of other things too. For example, medical devices that are within a hospital system, medical devices that individuals are wearing, medical devices that are used in surgical interventions, for example. And all of these are areas where we need a lot of improvement from a cybersecurity legal perspective. The question is, what should the law really do and what can technology do? And how do those two things really merge and fit together? Data breaches, of course, have not slowed down. This is a partial view. You can see 2024 is lower, but it's not that this is the full 2024 view. I believe that these numbers were taken about mid-year in 2024. But you can see that we see this steady increase over time. And these are the data breaches we know that are actually reported. There certainly are data breaches that may not be reported or may kind of fall under the radar. And those are really not accounted for here, especially smaller data breaches. So those of you who are familiar with HIPAA, you know that there is a prescribed time period where you're required to notify the Office for Civil Rights about any data breaches over a certain threshold. But even if you have a smaller data breach, you're obligated to disclose that data breach by the end of the year. Unfortunately, we still don't see every organization doing this, which is why, again, we don't always see an accuracy in terms of the numbers here. And one of the biggest breaches we had in 2024 was the Change Healthcare breach. And I think as somebody who worked for Target Corporation during the data breach at Target, which really shifted the focus of kind of what we need to care about legally to cybersecurity more generally, the Change Healthcare breach, I think, is really changing how we think about healthcare data breaches in particular, in part because it's been a banner example of how ransomware attacks can be extremely impactful to an organization and have really cascading effects. For those of you who are somewhat new to this area, Change Healthcare was a company that was acquired by United Healthcare, which is the largest healthcare insurance company in the United States. It provides private healthcare, but also provides, Medicare Part D and other types of supplementary forms of healthcare insurance. And the purpose of Change Healthcare was to kind of fit in between healthcare providers and insurers as a way of getting the data kind of ready to be reimbursed. So think of it as a go-between. We sometimes call these healthcare clearinghouses under HIPAA. So in February of 2024, Change Healthcare detected a ransomware attack, and it impacted reimbursement for several weeks. So you can kind of imagine how this might happen. It wasn't just that the insurer was impacted. In fact, the insurer, United Healthcare, was not even receiving the information. What was happening is that the private healthcare providers, including many very, very small providers, couldn't get reimbursement for services rendered. And for those of you who are pretty familiar with the healthcare sector, we know that margins are extremely low, meaning that you need timely reimbursement to essentially pay your employees to keep hospitals, keep clinics afloat. And so this was a hugely impactful situation because you have all of these entities that honestly can't get any reimbursement to function. And the ransom that was associated with the Change Healthcare breach was 22 million. And it ultimately was paid because of these cataclysmic effects and the potential impact of other types of legal actions later. For example, breach of contract is pretty common when you have these third parties that are contracting with Change Healthcare. And in July, Change Healthcare filed a notice of the breach with the Office for Civil Rights, but they didn't actually notify affected persons until February 2025. So, you can kind of argue about what is the utility of this kind of notice anyway. But I am one of the people who was affected, and I read a lot of these notifications of data breaches, pretty often. And I was very surprised at, I would say, the lack of specificity that was included in the notification. And, I kind of wonder to what degree that actually was very helpful. But nevertheless, from a legal perspective, so long as you are complying with state laws related to data breach notification, that is presumptively probably reasonable. But you're supposed to notify within a reasonable period of time. Some states have a specific time period. I might argue that, a year from the time of detection is maybe not reasonable, but that's something that potentially will be figured out in court. Now, it's suspected that this particular compromise involved attackers gaining access to a Citrix server that did not use multi-factor authentication. So for those of you who might be kind of new to the lingo, multi-factor authentication usually references something you know, something you are, and something you have, like something you physically have. So multi-factor authentication would presume that you're using multiple factors to validate a person's ability to authenticate. So some of you might be familiar with, a mobile device, you get a one-time code, maybe you get sent to an email. Those of you who are, of my vintage, you might remember the RSA tokens that you had on a key fob that you would bring. All of these are intended to ensure that whoever is connecting to a technology is who they say they are and have the ability to access not only that tool, but potentially those records. So multi-factor authentication has become a pretty common way of working now, even for consumer applications, not just for, I would say, highly sensitive data or highly important technologies. So Change Healthcare was just, one example. You can see that it did push up the number of affected individuals in 2024, probably put us over that threshold here. Now, this does actually account for 2024 more holistically, but you can still see that the size of data breaches, especially with these kind of extra large to super jumbo data breaches, are pushing the number of individuals affected up every year. And anytime you have a really significant breach that affects, tens of millions or hundreds of millions of people, you're going to have an overall effect. Now, the question is kind of the fact that Change Healthcare, that breach was, such big news that it affected so many entities. is that enough on its own to ultimately change what organizations are doing from a security perspective? And the answer is I'm not sure that I know. I think that other entities in that particular sector, maybe other healthcare clearinghouses are taking note. Certainly when I've worked for healthcare organizations in the past, they certainly take note of other data breaches. But the challenge is that in a lot of cases, these data breaches are not necessarily because that organization has really, enterprise poor security practices. Sometimes it's the implementation of a particular security practice into a particular technology. Sometimes it involves, questions of cost and whether something is likely to be exploited or not. There are organizations that do this very well and still end up having data breaches. So do we just give up, or is there something more that we ultimately can do? And I do think that there still is value in working at being better. And these data breaches can be instructive in at least saying, okay, if this happened to this entity, which is, fairly sophisticated, is part of one of the largest insurance providers in the United States, this means that it could happen to me too. But what we're actually seeing in practice, whether these are healthcare providers like hospitals, small clinics, insurers, basically anybody in the supply chain, we're seeing that there are a lot of, let's say, and I hesitate to use this language, but low-hanging fruit, right? Things that organizations could simply do better that are pretty easy to implement, that nevertheless are not getting implemented. And again, not all of this is because we made a really informed decision not to implement it, but rather because often there are just so many technologies and the overall attack surface is extremely large. So it's hard to basically plug all of the holes simultaneously. And, in some cases, it's possible because we have humans involved, we might just miss something. That can happen. Now, there are some reasons I think, or maybe ways that we can encourage organizations to do better, both as attorneys or if you're internal to a healthcare organization. And that's really to illustrate that, number one, data breaches are going to happen at some period, at some point in time. It's an inevitability. The question is how big that breach is and how much that breach is going to cost. The better your security practices generally, just from a statistical perspective, the lower the data breach cost is going to be to you, and potentially the fewer records are going to be affected, or even the level of harm associated with the data might also be reduced. So let's take an example where you have a data breach, but let's say that you are able to identify that it has happened within a week. That's very different than detecting it after a number of months. Why? Because ultimately you could potentially stop any exfiltration of personal information if it's ongoing. You might have a better sense immediately what the scope of the impact has been. And there might be even some traces of who perpetuated that data breach. And it might help you get a better sense of what has been impacted, or even help you refer information to the FBI or otherwise kind of figure out who the attackers are. So being able to act quickly, being nimble, being resilient is really the way that in cybersecurity we're discussing the application of controls and investment. So it's not just about did we have a data breach or did we not? But when we did have something happen, were we able to stop it from happening? Or were we able to rein it in, make it much more narrow in terms of its scope and its impact? And this is against, again, a framework of understanding that data breaches now are costing a lot more money. So as we see the cost of data breaches increasing, the question is, what can we do to keep any data breach that occurs that much lower? Ransomware attacks are a huge focus in healthcare now. Certainly, we've seen it in the hospital, like large hospital segment, as a much kind of larger focus. And why? Because it's more likely that one of those organizations is going to pay a ransom. Why would somebody pay a ransom in that case? Well, if you can't get to electronic medical records, if your medical devices don't even work, you're more likely to, negatively impact your patients. Folks might die. Folks might receive the wrong medication. I actually have an interesting story that occurred recently with a hospital that was undergoing a ransomware attack. A lot of folks who aren't, working hands-on as a nurse or a doctor might not know that there are a ton of Internet of Health things or Internet of Medical things that are actually connected to the hospital network and sometimes connected also to electronic medical records. So what can happen is, let's say you have a ransomware attack that takes down your network completely. Now you're not able to even use the medical devices that are used to get just basic information about a patient. And a lot of the analog or digital but not networked devices have been phased out. So what happened with one hospital that was undergoing a ransomware attack is they actually had to bring in nurses that had been there a lot longer, that had more longevity at the hospital, and they had to basically bring out all of these old devices that they happened to have in a storage room to be able to get just basic biological measurements of a lot of the patients. So the impact of ransomware is more than just, impact on electronic medical records. It also impacts the overall functioning of a lot of these hospitals and hospital systems. Now, based on some recent statistics, 75% of healthcare organizations report they really don't have the budget or the time to advance cybersecurity meaningfully. Now, the reality is that, especially for hospital systems, especially for emergency rooms in particular, but hospital systems in general, many of them are operating with very slim margins. And so the question is, how should they allocate their resources most effectively? What are the things that ultimately could lead to a greater probability of a breach? And something that I actually see as a huge area of focus is network security. And that's an issue for every organization potentially, but especially for a lot of hospital systems, in part because you have this common networking of a lot of local medical devices that are used in a variety of different applications within a hospital. And this applies not just to hospital systems, not just to insurers that do tend to have somewhat larger cybersecurity teams, but also in the medical device manufacturing space, which you would imagine would be an area where we have a ton of people who are focused on cybersecurity. 55% of medical device manufacturers didn't have a product-oriented incident response team, meaning that they wouldn't necessarily be able to act quickly if there was a product failure specific to cybersecurity. Now, this is pretty concerning. It might mean that they have a general cybersecurity team, but with medical devices, there's a very specific implementation sort of footprint that applies to that device. For example, if you have a surgical robot, something like the Da Vinci robot, for example, a lot of those are tied to the hospital network, but there has to be a connection back to the manufacturer to receive data that comes out of the surgical procedures that surgical robot, has performed, again, of course, with a physician. And so if you have a connectivity like that, the question is, have you protected your connection between the manufacturer and your network? And what can happen if your network itself is compromised? That's a very different implementation than, for example, an insulin pump that's connected to continuous glucose monitoring device that's also located on your body. And both are connected through your mobile device and maybe through a user application, but then share information backwards into an overall manufacturer infrastructure where all of that data is getting collected and fed into artificial intelligence systems that then make recommendations on how these devices can work most effectively. That connectivity is a very different kind of a footprint than the networked footprint within a hospital system. And so you have to really understand the type of product you have and its footprint to effectively protect it from cyber attacks. And 36% of healthcare organizations, today couldn't pass a security audit. One thing that we'll talk about very briefly here is the idea that there are auditing companies, there are third parties that provide different types of services for auditing, like HITRUST is one example. But a lot of healthcare organizations still don't use third-party audits, in part because they're very expensive. So, if we refer back to the other point that says, hey, guess what? Healthcare organizations don't have a lot of extra money to spend on cybersecurity. Well, they have often even less money to spend on a security audit. But nevertheless, security audits at least can flag some key areas of concern. They may not be comprehensive in everything you might have to do to create a relatively secure system. Okay, so I like to show this, not to talk through all of the details, but just to illustrate, and this is a very simplified, not a technical diagram, an architecture diagram or anything like that, but just to show all of the entities and their interconnectivity of protected health information, personal health information, device data, electronic medical records or electronic health records data. There are a lot of pre-existing relationships, and anytime that you see a pre-existing relationship, you should not imagine that, like in the past, when I worked for various organizations, we would actually download data onto a CD-ROM and we would put it in a briefcase and we would lock it. And sometimes you actually had it, tied to your body. That's not the world we're in now. If you see that there is a data sharing agreement, you better believe that there is an electronic transfer somehow, whether that's a bulk transfer, a file related transfer, or an ongoing connection. But anytime you have that kind of connection, there's a possibility that something can be impacted. So any one of these entities could potentially be compromised, or the relationship, the communication between them, the data sharing, could also be impacted. So this is a very difficult ecosystem ultimately to protect, while at the same time balancing usefulness of access to data. And that's part of the challenge we face too, is we want to make sure, because this data is so central to providing healthcare to individuals, that we also can't slow down the process so much that it's impossible to do that. Now, I still think we have a lot that we can do in the cybersecurity space that is not going to impact how we get data and how useful data ultimately can be, but it is something we have to think about as we're tailoring solutions. Okay, and of course, healthcare is not just the healthcare that we see when we go into a hospital or into a clinic. We've seen a lot of investment and a lot of venture capital firms that are very interested in alternative models of delivering healthcare, in part, again, because healthcare is very expensive, and there certainly are ways that we can reduce costs. Notably, most of these solutions involve internet connectivity, involve connectivity with other devices, multiple devices. For example, let's say that you'd like to keep an individual in their home longer. It might be an older adult that otherwise would be in a skilled nursing facility, but they're able to stay home as long as they have devices that can monitor various aspects of their health on a daily basis and provide that information back to a doctor. Now, that's a really, really cool idea. It's an important one. It has a lot of effects and benefits on individuals who might want to be staying at home. And it has a significant reduction in cost in terms of the cost of skilled nursing facilities, which are very, very expensive, whether they're paid for by the US government, by the state, or privately. And so there's a lot of investment that's moving into these spaces where a person doesn't have to actually be in a healthcare environment to receive care. But when you connect a lot of these devices, whether they're monitoring devices or if you're seeing a doctor over a connection, we do have the possibility, again, of those being compromised, depending on what the goal of that particular attacker is. Whether they are just, again, hoping to get a payoff in the case of ransomware, or whether they are looking to disrupt healthcare facilities because they had a bad experience. There are a lot of different motivations attackers might have. But we have to presume that all of these types of technologies are ultimately going to be impacted at some point, if they haven't already, by cyber attacks. But this train is not stopping, right? It is going to continue to build and grow, in part because we have a substantial amount of savings that we're expecting every single year. So even though we are, pushing this $330 billion into these technologies, we're seeing a corresponding 339 billion projected health savings every single year. So the payoff is enormous, which means these really are not going anywhere. But all of these ultimately include a significant amount of data, highly identifiable data, sometimes data that may not be identifiable, but is central to the operation of medical devices. And many of these are distributed systems, meaning that they're not within the control and management of one entity. There might be third parties that have some access to this information. There might be infrastructures that are managed by yet other third parties. Sometimes I call this, when I talk to my students, the third parties of the third parties. Um, and in all of these scenarios, we have to have everybody who's doing the right thing all the time. Well, that's just almost impossible to get. Even if everybody is following the law, even if every organization has a cybersecurity team, even if every organization is providing information to the entities who rely upon them to manage that data. So it's a little bit difficult. And I don't always want to have sort of a negative message here because I think there are a lot of things we can improve. However, expecting that all of these entities are going to work in concert and adequately protect everybody all the time is not a fair expectation, frankly. Okay, so medical devices, which are essential and part of healthcare delivery in pretty much every entity, used to be what we called medical devices, meaning that they were only in that medical facility. They were implemented in that facility. They didn't have any connections to these outside systems. They weren't provided via an application managed by a third party remotely. They were just a physical item. The insulin pumps of the past or the cardiac defibrillators of the past were something you could actually hold. That was it. Everything that you could hold was what it was. And they included within kind of the physical piece, in internal storage capabilities, which also meant that a lot of these devices were larger than they might otherwise have to be because they had to include, a battery, they had to include sensor technologies, they had to include computer technologies to make sure that they're working properly. Health devices now are increasingly more internet tethered. At least some of the external storage is often like historical data storage, gets sent over to another entity. And what that allows is that a lot of medical devices can now be smaller. So this model has led to developments in micro devices. For example, I'm not sure how many of you are familiar with this, but we have a pill that you can swallow that has a very small computer system in it that actually can document everything from the time you've swallowed it until you pass it as a way of doing some diagnostics for gastrointestinal issues. These types of technologies are really transforming how we do diagnostic medicine in particular. But the reason they are so small is because we are able to connect them to an outside system and you don't have to maintain all of that data on a device. For example, a lot of cardiac defibrillators and pacemakers have now a form factor that's much smaller. And increasingly, we're including artificial intelligence both in the programming of these devices and in the ongoing management of these devices. So at some point, it may not be real time. In fact, most medical devices right now are not changing by the minute or by the second. But what is happening is the data is being sent over to an organization, the manufacturer that maintains these devices. They're using the data to improve the overall artificial intelligence for the device. And then they're actually filing a supplement to a previously cleared device as a way of sort of updating, right? We're going to file the supplement and then we're going to send an update to the device with all of the updated characteristics, which could include, for example, security updates. Many of you who have mobile devices, I'm sure, are familiar with the regular updates. Anytime you see an update, you should presume that there are security updates that are part of that. It's the same thing with medical devices, but we have to be a little bit more careful because if there's a failure, there could be a really serious impact. And the organizations who are making these devices now are very different than they used to be. We have kind of a common development on both ends of the spectrum. On one end, we have big tech, which is getting very interested in the delivery of healthcare and medical devices. But we're also seeing a significant amount of startups that have not historically been in the medical space. Now, what does this mean? Well, it ultimately means that a lot of the larger tech manufacturers probably aren't as familiar with FDA process, with HIPAA, because they've been working in the primarily consumer sector. And we have small entities that have never had to go through the rigor of requirements under the FDA and probably haven't had to pay attention to HIPAA requirements either. So this kind of re-entry of a lot of other entities, not just traditional medical device manufacturers, has made the cybersecurity landscape, I think, very interesting and very challenging. So medical AI is exploding. Maybe some of you are spending time on medical AI in your own practice, or you're thinking about it, or maybe you even have a medical device. But we have seen a transformation in just the last 3 years. I think we now have a total of around 1,000 medical AI devices that have at least gone through FDA clearance. Now, keep in mind that there are devices that are kind of general human consumer devices that can be managed by an individual that are not being regulated by the FDA. So probably many more thousands of, let's say, the applications where you can, take a picture of a mole and say, yep, I think this might need to go to a dermatologist or not. Those types of applications are not regulated by the FDA. At least the FDA has not exerted any regulatory uh, requirements, including for those devices. And the 21st Century Cures Act of 2016 basically told the FDA that they're not supposed to be regulating true consumer health devices. But we know that a lot of those devices can kind of skew more medical device or more consumer. The FDA has not seemed too interested in regulating those so far. Um, the one time where they have been kind of interested is where we've seen applications that ultimately render a diagnosis without a disclaimer that says this is not medical device or this is not medical advice. So situations where you might have a medical doctor that would otherwise render a diagnosis, but in this case, the technology is doing it. That's where we've seen the FDA want to regulate. But most of the developers ultimately are a little bit more intelligent than that. And it's a lot easier to get it through a process of offering it to the public if you just include that disclaimer that this is not medical device. All right, 1 second. Okay. I mentioned the monitoring devices. We also have personal diagnosis coaching software. That's again falling more in that consumer health area. We have a lot of new medical devices that are conducting some form of surgery. And the idea is that, of course, if you have microsurgery or let's say surgery where you don't actually have to cut the surface of the skin, you actually can have a much, much better result and fewer infections after the fact. So there are a lot of real positives to that. And then personal medical devices are also gaining a lot of steam. We're seeing some of the first insulin pumps that are available for type 2 diabetes, which previously they were not available for. We now have an artificial pancreas. These are hugely impactful, of course, to our population dealing with diabetes. And hearing aids have become, an area of a ton of focus, in part because many of our population eventually will need a hearing aid. And many of those hearing aids include AI. They automatically adjust to the environment you're in. They collect information about the individuals who you are talking to on your mobile device, your contact information. Often they include information about your playlist if you choose to integrate your devices with your playlist and use them as headphones. If you're having coffee with somebody, it will often capture the voice of the person you're sitting with. So from a privacy perspective, that can be a little bit concerning, but from a cybersecurity perspective, it might also be because we're collecting a much larger cache of data that we now have to protect. And often when I give presentations on privacy, I try to reinforce this idea that, whether we're talking about privacy or we're talking about cybersecurity, there's one thing we do have in common almost always, and that's data minimization. The idea that if we have less data and we haven't duplicated data in multiple ways, we have less to actually protect. We can allocate our resources more narrowly. But with the introduction of a lot of these devices, we're seeing a really significant growth in just the volume of data we have to protect. So it becomes harder to do your job. Here's some examples of a variety of different AI-enabled medical devices on the market now. I just think it helps to kind of illustrate that there are a variety of different types of devices. They're not just what we normally would think of. AI healthcare in particular, a lot of folks talk about diagnostics, which absolutely is a big part of this, but we have a lot of physical devices now that are connected with AI backend systems. And if that information that is sent to that device is incorrect, is corrupted, or is stopped, we can have very real, what we call cyberkinetic attacks that affect people's individual bodies. So when we talk about data breaches, it's not just, hey, we lost some sensitive data. It's, hey, we have something that's now malfunctioning in a person's body. So like the level of gravity, now these issues always existed to some extent, but the proliferation of AI-enabled medical devices is making this issue much, much larger. And here's just a very simple example of what we're seeing happening in the medical device space, which is, you might have two devices that are implanted in a person's body. Here you can see a pacemaker and an insulin pump. And we're finding ways where those organizations can connect to applications that are on mobile devices or laptops, tablets, et cetera. But then also those devices can communicate with each other. Now, what does that mean? Well, ultimately, if one of these devices is compromised, that might mean that that device is able to compromise the other device as well. So anytime that we are forming connections, we have to ask a question of what controls are in place that are preventing someone from basically corrupting that transmission. You'll have to excuse me, I'm just getting over the flu. Okay. And then we usually have a variety of different servers that have different functions, and they're connected to a big data set and also machine learning utility or a number of algorithms that might be stored in multiple servers. But I mention this because often we have a lot of challenges in protecting large databases. Encryption is one of the models that we use to protect these databases, but it tends to be quite expensive. In other cases, we haven't always done the best job of rotating encryption keys. We haven't always figured out where's the best place to store encryption keys or who should have access to those keys. And you can imagine that if any step along the way, let's say you have three people who have access to the utility that creates encryption keys. If one of those people is compromised, whether it's a social engineering attack, maybe it's a virus that has a keylogger or something similar. Now you might have somebody who looks legitimate in terms of they have access to a particular utility, but you have a hacker that's using their credentials to do it. These types of things have happened in the past, but because we're now even more reliant on these large data stores to power these devices, this issue becomes a lot more serious. And as I mentioned before with data minimization is really a key challenge for us because the more data you have, now we are seeing some developments where because of the environmental impact, especially in large language models, which are kind of a different implementation of neural networks that we might see with medical devices, but they can be somewhat aligned and used for complementary purposes sometimes. That because of the environmental impact of storing this amount of data and running these machines, we are trying to create, I would say, slimmer implementations, meaning that you can train on a smaller amount of data effectively and get the same result. So there are some developments that are happening. But I just want to mention that anytime we are talking about AI, however, we still have an enormous amount of data that we have to protect at every single step of connectivity. And because of the way that we implement neural networks, we have a variety of hidden layers that might be very hard to decipher if something has been adjusted, if something has been changed when the model is attacked by a cyber attacker. It may be very difficult for us to ascertain what has happened. Now, there have also been some research developments in terms of explaining what's happening within the hidden layers, often using other AI to do it. But again, the more levels of computer applications we have, the potential that we might exploit any one of those as an attacker. So one of the ways that we've tried to kind of get to a solution in the past is through de-identification. So can we take all of the data that matters and ultimately remove it as a way of protecting an individual? Now, this has been keyed, I would say, more to the model of a traditional data breach versus cyberkinetic attacks. But the idea is that if we can take all of the data out that is useful or even separate it, right, through pseudonymization under HIPAA, pseudonymization where you have, let's say, highly sensitive data here and not sensitive data in this database, and let's say you heavily protect the highly sensitive data, that model in the past has worked pretty well for reducing the potential impact to the highly sensitive data, which then triggers notification of data breach under most state laws and under HIPAA. But de-identification doesn't work quite as well when we're talking about data that may not be personal information, but may be essential to the function of various hospital systems, of hospital networks, of medical devices. And anonymization and de-identification are different standards anyway. So even if we're de-identifying, in most implementations, we're talking about pseudonymization, which means you still have the sensitive data. You're not removing it completely because you need it to actually function. An example would be in an electronic medical record or electronic health record. You still have to have those sensitive characteristics, otherwise it loses its utility. But the more data that we have, potentially the more likelihood we have identifiable data and that a hacker could actually put the pieces together using some common utilities and identify who the person is. That can be used as a starting point. So we often see social engineering, like phishing is one example of social engineering, but we also have social engineering that involves using enough personal information about a person to get them to do something that maybe they wouldn't otherwise do, but seems like low stakes to them. So an example might be, we have all of this information about the sexually transmitted diseases that you had. We're going to send it to your partner who doesn't know about it, unless you let us use your login credentials for 5 minutes between this time and this time. Now, that's not something a person would normally volunteer, but if that information is being used to induce that person to do it, 5 minutes doesn't seem that long, right? It seems small. And so we see that sometimes medical record data can be used to perpetuate something much larger. And ultimately, other types of data, so especially for medical devices, we might be interested in creating synthetic data. Synthetic data is data that might be based on existing data, but it can't indicate, like you can't kind of reverse engineer and figure out what its basis was, what the actual personal information is. Synthetic data is created data. So there are enough differences where we can't tie it back to a real source, but it works as if we had real data. So synthetic data is an area of a lot of interest and exploration, but it tends to be quite expensive to make. And so we don't have it on the level of scale that we might need to train a lot of AI functions today. And just bottom line, laws like HIPAA were ultimately not designed for these technologies overall. And so medical devices, of course, are also compromised to a large extent. But we haven't seen a lot of, let's say, big news where people have been hurt, seriously hurt. So that's the good news, I think, for medical device cybersecurity. But 53% of medical devices, according to the FBI, had at least one known critical vulnerability. So that means it's a vulnerability we already know about, and it has a really substantial potential impact on the failure of that device. And in 2023, we saw an uptick in the amount of vulnerabilities and data exposures. We will probably continue to see that ongoing. Okay, so when we're talking about healthcare cybersecurity, just keeping an eye on time, I'm going to try and wrap in the next few minutes here. We see sort of a co-regulation space. HIPAA applies to covered entities, which are healthcare providers, healthcare clearinghouses, and healthcare plans. So usually insurers is sort of our shorthand. And their third parties when they are handling protected health information that originates from one of those entities. So HIPAA is fairly narrow. It's narrower than we might expect. FDA focuses on the types of medical devices that it has elected to regulate. And so those are limited in nature, and there may be some overlap and maybe not. So some medical devices could be covered entities under HIPAA. They might be business associates, or they might be neither. And a lot of medical device companies actually will segment portions of their business in this way because HIPAA has a pretty significant regulatory burden, not necessarily for cybersecurity, but definitely for privacy. So we have these kind of two areas where we might find cybersecurity requirements. Under the FDA, we have the FDA that prospectively clears devices, but often security is not examined in a ton of detail. We have seen some improvements in what is included in the law, but again, fairly narrow, fairly limited. A lot of it is left to what we call post-market adverse event reporting. Okay, so the HIPAA security rule right now does include addressable and required requirements. It tends to make it kind of confusing. Basically, addressable requirements are also required unless you have a good documented reason. But it mainly consists of administrative and procedural controls. So these are process, right? Business process. Technical requirements, and this should actually say no technical requirements are considered required, meaning that they are all addressable. You could have a very good reason not to, for example, encrypt protected health information, even though that seems like it's pretty important. But there are a lot of common technical requirements that are not noted that include details around encryption, authentication procedures, vulnerability management, which we know is a huge area of interest. And although we have requirements under the data breach notification rule, we don't have specific requirements around incident response processes, meaning what happens when a data breach has occurred? How do you respond quickly? So HIPAA has some at least proposed security rule changes. The Department of Health and Human Services posted these according to the Administrative Procedure Act at the end of December, so right before we hit the new year and the new administration took hold. And typically the notice comment period is around 60 days. So presumably this is under consideration. We don't know what a final rule will look like or if a rule will be issued. A notice of proposed rulemaking does not necessarily mean a rule will be issued, but it made a lot of serious improvements on kind of what we were seeing historically under the HIPAA security rule. For example, it stopped this confusion around addressable and required and just said, hey, it's all required. It mandates encryption with few exceptions, which although encryption isn't everything, it is a significant control that we use in security. So if you were able to get access, for example, to that database, or you were able to see a transmission between two entities, what you would see would not be something that would make sense to you. It requires multi-factor authentication, which can be a little bit kind of touch and go. It can sometimes create additional friction in the process of trying to get things done in a healthcare environment, but generally is a pretty solid control and something that we see in most sectors under most applications where you're dealing with sensitive data or important data. It requires full documentation, so you actually can understand what your systems look like. You can understand, if you saw my spaghetti graph, right, you can understand what those relationships are. And it requires much more detailed risk analysis, understanding of what your assets are, threats, potential vulnerabilities, and existing vulnerabilities. And it includes greater specificity and contingency planning. So under HIPAA, contingency planning is the same as business continuity management. That's what we call it more generically in the cybersecurity community, which basically means that you've planned for something to go wrong. You've planned potentially for there to be a ransomware attack. Can you recover quickly? Meaning if you had a ransomware attack, do you have a secondary source of data that you can quickly shift to so that it doesn't impact your performance? So you can see here too, it requires network segmentation. So, can you ensure that if a part of your network is compromised, that the entire network is not compromised, and that you have this backup and recovery approach. So all of these are like really, really great rule changes. We just don't know if they ultimately will be adopted. And I think at this point, it's a big question mark, at least in my mind. But we also saw some updates under the Food, Drug, and Cosmetics Act. in 2022 that were very useful. As you can see here, cybersecurity controls, cybersecurity plan, which includes vulnerability management, understanding potential exploits, and it reviews, again, this maintenance of process and procedures, which alone don't really do anything, but do force an organization to at least understand what they're doing, which is a good first step. Importantly, it requires organizations to provide a software bill of materials. So a bill of materials just means that you've listed out who everybody in your supply chain is. So all of those other entities that you are transferring protected health information or personal health information to, you know who they are. Now, the reality is these are not published. They're not publicly available, but at least the FDA would know what they are. All right, so just how do we outpace attackers? Well, the biggest challenge is that we don't always know what they're going to do. They're not completely predictable. Some attackers concentrate their attention on one entity, and it's very, very hard to defeat an attacker that has unlimited time over a long period of time and is focusing on you. Some entities, they'll fall to attackers, especially, let's say, lower expertise attackers, because their controls just aren't as good as alternatives. Again, this is kind of I often say, if a bear is chasing you, you don't have to be the fastest runner, but you can't be the slowest. But that doesn't apply to all attackers. Some attackers that are really focused on your organization are going to find a way no matter what it is. And it's impossible to best every one of these attackers simultaneously from every hacking entity at every time. You have to imagine that you're the goalie. If those of you who are football or soccer fans, imagine that you have an unlimited number of people who are shooting a soccer ball at you as a goalie. I mean, eventually some are going to go in no matter how good you are as a goalie. So you have to really figure out what your resilience approach is going to be. What happens? How do we get on top of it when we know that we've been compromised? And do we have the right technology in place to know that we've been compromised as quickly as possible? And I just last wanted to illustrate that we can't rely on regulators to do this work for us. The number of OCR violations you can see here, even in 2023, it was only 13 organizations. So just saying, hey, the OCR is going to catch these organizations that don't do the right thing is really not a fair expectation. And we're also seeing not a lot of interest in sort of a litigation approach in pushing this, in part because HIPAA does not have a private right of action. Now, some state laws may start to have that for healthcare information independently, but we just have not seen a lot of interest in that being the main way that we get organizations to change. So overall, I think that there are positive things that have been shared. I don't know what's going to happen with those here in the next couple of years, but I think that organizations can do a lot, even if these end up not being kind of the final rules, to improve their basic programs by implementing general controls, by ensuring that they are resilient as much as possible, but really by understanding what's happening within their organization as a starting point. And with that, I'll wrap and open it up to questions.
Please place any questions in the chat. I have a question. Are there any particular devices or companies that are particularly bad? I don't know if you can speak to it at like even more than at maintaining their security and maintaining the privacy.
Yeah, so I wouldn't name specific names, but I will say this. The larger medical device manufacturers know that this is a potential problem and have invested pretty heavily in creating teams that focus on products. And I had the fortunate benefit of working for Medtronic for quite a while and interfacing a lot with the cybersecurity team when I was doing privacy and AI related work. And I was very impressed. I think, though, there is always a challenge when we're talking about novel cutting edge devices. There can be a little bit of friction between cybersecurity teams that are saying, no, you need to lock this down. You need to implement this, this change, and engineers who are trying to get it to work as effectively as possible. I think that's a natural friction. I don't think it's a negative friction, but sometimes that can result in products not being quite as secure as they might otherwise be, or if the implemented control is very expensive, because we're still trying to sell products. I'd say an area that I think is most concerning, at least to me, is in the startup space. And the reason is because a lot of startups have like 3 people, 4 people. Sometimes even if they have 100 people, they're primarily engineers, maybe finance folks, a couple finance folks and a CEO or a founder. But they don't often spend as much time on, let's say, making things as secure as possible, focusing on things like compliance. And I'll just note that cybersecurity is something that really is not necessarily about compliance. It's about good engineering practices. But sometimes when you hear cybersecurity as an engineer, you think, oh, they're coming in to ruin my fun, kind of like the legal compliance folks do. But the reality is it's just to make a product that's going to fulfill all of the aspects it has to fulfill. Um, and what can happen sometimes too is when you have a startup, it ends up getting acquired, that technology, by a larger entity that believes that you've done all of that work already. And in the case of AI related technologies, the larger entity may not even understand the details of the technology that you are working on. And they're reliant on you to ensure that you've done the right thing. Now, smart organizations that are involved in those transactions are going to do security assessments before they, sign an acquisition agreement. They're going to figure out if those entities even have rights to the data that they've previously used, to train the AI. So there are a lot of things that an acquirer can do, but they really shouldn't short circuit the process of looking at the technology. And even if that means hiring a third party to do it, if they don't have the technical chops. But that's where I see a lot of the problems. That and from a let's say, manufacturer perspective, hospital systems tend to be very insecure right now. And it's tough. Like there's movement, but it's just not as much movement as we would like, largely because of the costs.
Well, that leads into our next question.
Yeah.
All this regulatory work is quite expensive for the business. How would you recommend talk? Well, first one. All this regulatory work is quite expensive for the business. How would you recommend talking to your client business about the need for investment around cyber and privacy to ensure there is enough investment in the space?
Yeah. Well, I mean, it all depends kind of on the size of the organization you're dealing with. But if you do have somebody who is a chief financial officer, a chief risk officer, somebody who regularly is dealing with sort of unknown potential future risks and trying to guard against them, that's a person that can be a great advocate, in part because they understand that just because it's not happening now doesn't mean it won't happen. And there are a lot of great statistics that you can use to illustrate, like, hey, this is going to happen. We don't know when, but it does mean that we have to do something to prevent the impact from being really high. One thing that I've talked about is a cost sort of orientation. If we spend the money now, it's going to cost X amount. But if we wait until we have a data breach, this is the cost of the data breach. This is going to be the cost for potentially like monitoring for all of these individuals that we now want to offer. And this is going to be the cost of doing the forensic analysis. And this is the cost of actually doing the remediation that we could have built correctly the first time. And when you look at the difference in those numbers, that can be very persuasive, especially to someone like a chief financial officer, or somebody who's trying to kind of think 3 years ahead. It can sometimes be more difficult for someone that's just trying to get something out the door. You may not always find a great audience. They have to be thinking sort of ahead and realizing that what we do today matters, what our future risk is going to be.
We have another question. One of the most challenging aspects about demonstrating good cybersecurity in private practice is the balance with operational security, i.e., not sharing operationally sensitive data that might otherwise tip off a would-be threat actor.
Yeah.
Is the balance between operational security and transparency with law enforcement something that comes up in the academic setting? If so, how do you think about that balance in discussions?
Yeah, I think it does. I think it does, and it's not only in the sort of sharing with government space. I would say it also happens anytime you're an entity that's being audited or assessed by another entity. There are questions about, can you show us your policy? Can you show us, will you allow us to do a penetration test on your technology? These are all well-meaning things. And I think that, I mean, ultimately sharing with trusted entities, sharing with government, if it's limited, right? Sharing what is necessary, not sharing everything, not being an open book, I think has more benefits than risks. Is it completely safe? No. No, of course not. Anytime that you're sharing information, you run the risk of potentially disclosing it to someone who could use it to their advantage. Um, and I will say that this has happened with some data breaches too, where let's say a SharePoint site was not well protected and an organization had, guess what, all of its security architecture diagrams on that site. Boy, that's kind of a problem, right? So sometimes it's the little things, right? It's ensuring that that information is protected when it's internal to an organization, that has the right confidentiality label, and that you protect it consistent with whatever that label is, and that you only share it in limited circumstances. Something that we've done in the past is you would show it on a web, a web copy, but you wouldn't actually send them a copy of the document. Now, could somebody take a photograph? Maybe, but it's less likely to be, shared with a large number of people. So it's not a perfect answer, but it is an issue.
I believe that that's all of our questions, and that is time. Thank you, Charlie, again so much for doing this. It was a great talk. And yeah, thank you everyone for joining us.
Yeah,
Have
and
a good
feel
day.
free to reach out anytime. I love hearing from attorneys and students. So please feel free if you'd love to discuss something, I'd love to hear it. Thanks so much.